Good evening. Myself, Dr. Ushyendra Sharma, practicing in Shimla Agency. My years of experience are 16 years and in this field, and I'll just briefing you about some do's and don'ts about myocardial infarction, and commonly we say heart attack. So basically, we all know that heart attack is basically the blood supply to the heart is decreased because of the functioning of the muscle of the heart starts to decline. So how this happens, I am just briefing you. Basically, what happens in there is acute stressful condition. Whenever there is acute stressful condition, whether it is the sudden rise of blood pressure or some sudden lack of oxygen, like we go to high altitudes, or some pollution, or some lack of oxygen, or some stressful, like some sudden hearing of some stressful news can also trigger this myocardial infarction. So what happens is basically the blood supply and the demand, there is the mismatch, and heart function suddenly goes out of the way, and the blood which usually the heart pumps is not able to pump it. So what happens is there is acute severe chest pain. There is severe chest pain which is generally going to the back or arms, or heaviness in the chest, like somebody has put your this 100 kilos weight into your chest, or sometimes this perspiration. Not sometimes, it is most of the time seen. Sweating is the one of the most common symptom. So sweating, chest pain, which is radiating to back, chest tightness, and sudden loss of consciousness sometimes. So it is very very important you recognize these symptoms. And sometimes vague chest pain also in diabetic patients or some CKD patients can also be there, because they are not able to feel the pain like the normal persons do. So now, what are the do's and don'ts? You have to maintain active lifestyle. You have to maintain your blood pressure. If you are taking your medications for blood pressure, you have to take them regularly. What I mean to say is that whenever you skip the dose, there is sudden rising and lowering of blood pressure, which leads to sudden loss of blood supply, and which can trigger an event. So, and very important, you maintain your hygiene, because some acute micro infections are also implicated, like dental infections, mouth oral poor oral hygiene. Some skin infections can also trigger an this heart attack. Some viral infections, like rickettsial infections, scrub typhus, some other infections also can lead to this heart attack. So very important is the prevention. So how to prevent? Maintain healthy lifestyle: fruits, nuts, vegetables, healthy oils, good sleep, healthy nutrition, adequate hydration, and proper maintenance of blood pressure. When you are taking blood medication, it's okay, or when you are not taking medication, you have to maintain this very good healthy lifestyle, like walking around 30 to 2 hours per week. More than 2 hours a week, it is better, but it has to be maintained according to your weight, because when your weight is high, acute stress can also lead to some this trigger. So now, what are the complications? The complications are many. Stroke can occur. Heart failure can lead to fluid retention, swelling of feet, this loss of consciousness. Seizures can also occur. Electrolyte disturbances can occur, and some other so heart failure is very common. This complication of this heart attack. So you have to prevent as long as possible after the heart attack is there. So nowadays, what is happening is even young individuals are catching this heart attack. Why? Drug abuse, cocaine, LSD, smoking, this bhang, heroin, what we say chitta in language, local language. So it is very important you guide as a good Samaritan, good citizen, that you guide the society, that you keep away from all these drugs. It is very difficult to say, but still you have in society, you can lead the contribution. Other is this pills. Whenever you are see, what I recommend to my patients is pills are just like food. You have to take pills, you have to take food. These there are same one and same thing, and you have to be very religious in taking food as well as medication. So healthy food, healthy medication, and healthy lifestyle. This is the message I want to convey. If in case symptoms, sweating, chest pain, or some other heaviness in the chest can occur, immediately you go to the hospital, immediately get your ECG done. And if even the small T wave inversion, ischemic changes, ST inversion, if these ECG changes are there, immediately consult your doctor, physician, and immediately you are put on your medication, and further your life can be saved. Thank you.